Welcome to Business Line's State of the Economy podcast, where you'll find insight, analysis, and the story behind the numbers.
Hello and welcome to the State of the Economy podcast. I'm Jyothi Datta. 7 in 10 people living with diabetes found out that they had the condition only after developing complications associated with it. These were the findings of a study released by the International Diabetes Federation ahead of the World Diabetes Day earlier this month. So should India be worried? After all, it is home to the second largest number of people with diabetes after China, that is. And to break this down for us and to understand the new developments around diabetes medicines, insulin, etc., we have with us Dr. V Mohan, Chairman, Madras Diabetes Federation Research Foundation, and Dr. Mohan's Diabetes Specialities Center. Thank you, Doctor, for speaking to us.
Yeah, thank you, Jyothi.
So, Doctor, India is estimated to have about 101 million people with diabetes. How concerned should we be on these findings that many find out that they are diabetic only when complications arise?
Thank you, Jyothi. I saw that report which you were mentioning, and while it's partly true, I don't think it's fully true because we have also done earlier studies to find out when people are diagnosed with diabetes, what percentage of them already have complications. So it turns out that's about 6 to 7% of people who on the day of the diagnosis, they already have eye changes or nerve changes or kidney damage. So in these people, obviously, it is being diagnosed very late, maybe even 10 years or more. The diagnosis is missed. Having said that, in all surveys, what we have found is that about half of the people do not know that they have diabetes. For example, if there is a community and you're screening them, and before you do the screening, you find out, let's say 1,000 people have diabetes. When you screen that community, you will find that another 1,000 also have diabetes, but they didn't know about it. So yes, unknown diabetes or undiagnosed diabetes is very common. About that, there is no doubt. However, while a small percentage of them also have complications of diabetes, which means it's gone uncontrolled for 10, 15 years or more, in our studies, it has been less than 10%. Even that is significant. If 7 to 10% of people have already early complications of diabetes, that is not a very desirable thing. Bottom line is that we should try to have periodic screening whereby people are diagnosed early and we don't allow this uncontrolled diabetes to go on for many years.
Correct. Even with the numbers that we have, when you say 6 to 7% knowing of it on diagnosis, that makes it a large, burden.
Out of 100 million, that's going to be a large number by itself. You're right.
Absolutely. And we also have an additional pre-diabetic population.
Yes.
Who are on the borderline. Okay.
In fact, the number of people with pre-diabetes is even higher than diabetes. In the ICMR INDIAB study, we found 101 million people had diabetes, but 136 million people had pre-diabetes. And there are some studies which have shown that even at the stage of pre-diabetes, a small percentage of people can have complications. Now we know that the large blood vessels in the body, that is the heart, the brain, and the peripheral feet, and so on, these blood vessels are known as the large blood vessels. And for them to get damaged, you really don't have to reach the stage of diabetes. The stage of pre-diabetes itself, it can damage the large blood vessels. But we're talking about the small blood vessels, which affect the kidney, the eyes, and the nerves. These usually get affected only after diabetes sets in. And that's why diabetes is actually separated from pre-diabetes. But in a small percentage of people, maybe 2%, 3% of people with pre-diabetes, they can even develop the microvascular complications like eye, kidney, and nerves. So the earlier we screen, we'll pick up diabetes and we'll also pick up pre-diabetes. And at that stage itself, we can take preventive steps and treat it.
As you have indicated, more steps to be taken to manage this. Rather than, looking at the perfect outcome of cure or reversal, to even manage it better, which is a good thing and which is possible given the drugs and the lifestyle changes one can make.
Yes.
So, doctor, wanted to check with you. We see across the world there is this drugs that are and injectables that are taking the world by storm. whether you see Ozempic and Wegovy, and we read all of this, and this international popularity is in fact even putting pressure on their supplies. But I believe these are injectables that are not yet available in India yet, or maybe. But what would you say about these two, products?
So they are absolutely, become very popular abroad. And as you said, it's even led to, in some places, black market situation because the drugs are not available. It's like gold or diamond or something like that. People are so crazy to get these drugs. There is no doubt that they're very effective, both in controlling diabetes and more importantly in weight reduction. Over the years, we have not had very successful weight reduction tablets or medications. Many of them, which from the 1980s, 90s, 2000, 2000 up to around 2010 or so, most of the weight reduction drugs have a very, a bad history because within 4 or 5 years, some severe side effect is described and the drugs had to be withdrawn. On the other hand, this class of drugs, the GLP-1 receptor analogs, of which semaglutide is the drug you're talking about, Ozempic and Wegovy come under semaglutide injectable once weekly. Now, these drugs have already stood the test of time, and in trial after trial, they have been shown to be very effective. And people love it because of the weight reduction that they get. And you're quite right that it's not yet introduced in India. I understand that Wegovy is likely to be introduced in India, and Ozempic is actually both are same. It's only related to the dose of the drug. So semaglutide in oral form, it's called Rybelsus, and that is already available. 3 milligram, 7 milligram, 14 milligram, that is already available. The oral one is also good, and of course, it's not an injectable, and you have to take it every day. But it is not as powerful as the injectable semaglutide. Now, as you rightly said, dual agonists, and Mounjaro is one of them, tirzepatide we call it. So this tirzepatide is from another company, and this has even better the body weight reduction compared to even semaglutide, compared to Ozempic or Wegovy. So that is also making a lot of waves. It's called Mounjaro, and tirzepatide, that is also likely to be introduced in India. We don't know when, but we're waiting for it to come. Meanwhile, a triple agonist called as co-agonist, ritratrutide. So that's a third one where three hormones, GIP, GLP, and glucagon, all the three are combined into that. And with that, the weight reduction which has been described is almost unbelievable, almost like a bariatric surgery where they are able to get. So people who are grossly overweight, they love these drugs because it's a weekly injection and you take it and you lose a lot of weight. Of course, they are expensive, and so not everybody will be able to afford it. And we have been describing, that telling Indian manufacturers, why don't you think of bringing generics of these drugs or biosimilars of these, so that if made in India, it can be made much cheaper because it is needed for our people. But you're right that these drugs are taken whole country by storm wherever they were introduced, and we are likely to see that in India. I understand that already there are people importing it for their personal use from abroad. So we are all waiting for it to come to India.
Really fascinating developments around, the drugs here. You did mention oral semaglutide, and I think you and others have also called it a game changer in that sense.
Yes.
But and you also mentioned price, so it's priced at about 10,000 a month.
Yes.
But how has its acceptance been in India, doctor? Both in terms of has price been a bit of an inhibitor in that sense, and in other terms, in terms of the the scientific side, it's working well with Indian patients?
Yes, it is working well in Indian patients, both diabetes control as shown by the HbA1c reduction, as well as more importantly with the weight reduction. It has been very effective. Now, regarding weight, I would say that weight reduction, no other drug is able to match this group of drugs, the GLP-1 receptor analog. We also have the SGLT2s, which are also oral, and it helps to reduce weight. But if you look at sheer weight reduction, nothing can come near the GLP-1 receptor analog. So many of my patients are very happy, And after adding that, their HbA1c has come down as well as their weight has come down. Now, the limiting factor is the cost. As you mentioned, it's about 10,000 rupees. But whichever of these comes, even earlier, the injectable, we had liraglutide, it's a daily injection. Then we had dulaglutide, it's a weekly injection of another company. Now, whichever drug has been introduced, the ballpark figure is going to be about the same. Whether you take it orally or you take it injectable once a week, daily, all come to roughly the same, give and take a little bit here and there. So for a common man, a pensioner or a common man, slightly outside their budget, because spending 10,000 rupees just on one drug when you've got all other medications to also follow is not something which people can afford. So we should think of, if these are really essential, we should think of getting subsidies for that, or government procuring it and giving it to people who can't afford. So that's a secondary. Equity distribution, equitable distribution is another thing. We are talking only the science part here. And except for some little nausea and so on, for which you give start with lower doses and then build up the dose. So if that way, if you do, the side effects are also manageable. But overall, they've been very successful products.
You did mention Indian manufacturers, and again, something that we see this month was that a biosimilar of insulin aspart was launched in India by a local drug maker
Correct.
who was
Correct.
earlier making diabetes medicine. So, what is the significance of this sort of an insulin, which is a newer insulin in that sense?
So, I mean, it's a biosimilar. So, it is not a new molecule or anything. It is a biosimilar. So, the aspart, the original aspart, which is produced by another company, the Indian company is now able to produce it in India, and all the necessary trials have been done. So, if the cost substantially comes down, I think it will benefit Indian patients. So, therefore, I would think it's a welcome move. I also understand that one of these GLP-1 receptor analogs, which we had earlier, called liraglutide, the trade name for that is Victoza. So I believe that 2 or 3 Indian companies are already in line now to prepare liraglutide, which will become available quite soon, I understand. So I think these kind of biosimilars are produced, and if the cost comes down, it's a welcome move, because it will then help a lot more people than currently we are able to give it to.
So this is a quick acting insulin.
Aspart, yes, that is true. It's normally given 3 times a day, and it can be taken with people with type 1 diabetes, and even with people in type 2 diabetes who have got long duration, they start behaving like type 1. So there you can use it.
So, Doctor, you did mention equity. Now we see in the US these campaigns which are being led by the administration right at the top, to sort of keep insulin prices under control and to bring it down. In India, are these newer versions of insulin covered by insurance, for instance? I mean, we've spoken about this earlier also. Do you think they should be, as you've said, government procurement is one, but how does insurance look at this? Health insurance?
I think in India, I know that in some countries, Middle East and Dubai, Abu Dhabi, these kind of places, they pay, insurance pays for medication. So if they believe that by giving these medications, the ultimate complications can be reduced, and therefore they save there. To the best of my knowledge, in health insurance in India, only pays for hospitalization and only pays for surgeries, accidents, heart attacks, those kind of things. So if you get an emergency and then you get admitted in hospital, they would pay. But for routine care, outpatient care, domiciliary care, where routine treatment of diabetes, not only insulins, tablets, nothing is covered actually. There may be some exceptions coming in now, but by and large, only if you get hospitalized, it gets covered. So that is something which we'll have to kind of change going forward, because if people control their diabetes well, the complications will be less, and the cost of the complications is much more than the cost of treating diabetes itself. And so from that angle, I think we should encourage insurance people to start paying for medication, because that will help people to continue their medications. Otherwise, after some time, they tend to drop out.
Absolutely. And bring down healthcare costs. Hopefully, your thoughts will trigger some of that conversation.
Yeah.
Doctor, you spoke about complications. I just wanted one more thought on that. The complications around the liver. Now, I understand, have started a liver-focused,
Clinic. Yes.
center. So why was that important? If you can explain.
Yeah. So, non-alcoholic fatty liver disease, because fatty liver can come due to alcohol, and in those who don't drink, that we call it as non-alcoholic fatty liver disease. This excess fat in the body, which circulates in the blood as triglycerides or free fatty acids, once they go into the liver and to other organs, muscle, and so on, the fat tends to settle down there. And in people with diabetes, more than half of them have fatty liver. And if you have diabetes and obesity, then it's more like 80% have fatty liver. So fatty liver can produce diabetes and diabetes can produce fatty liver. It's a bidirectional relationship. So, and the fatty liver leads to insulin resistance, which means the medicines don't work, insulin doesn't work, they need high doses of medicines. So there's a close connection. On the other side, the fatty liver, non-alcoholic fatty liver disease can go on to what we call as steatohepatitis, which means that inflammation of the liver will occur from just fat getting deposited. It's a benign condition to inflammation of the liver will occur. And that later on can lead to shrinkage of the liver, what we call a cirrhosis of the liver. And that is a dangerous condition unless you are able to do a liver transplant or something. The cirrhosis can be fatal because there's no cure after cirrhosis sets in. And some of these patients' cirrhosis even go on to develop hepatocellular carcinoma, which means cancer of the liver. So, having said that, I think it is important to, in the diabetic clinic, just like we check the eyes, kidneys, heart, feet, nerves, we also have to check the liver. So that is why we set up a liver clinic to study liver problems in diabetes. And today we also have some medicines by which this fatty liver can be reduced. It can also help the diabetes. So it becomes part and parcel of a diabetic clinic.
So in terms of, or as you indicated right in the beginning, it's very clear you need to screen early and get, one is of course your medication, but as you've always indicated, also to get your
Lifestyle.
fitness and diet and everything else also in place. So one final question, in terms of, look at the marketplace, there are a whole bunch of products which claim, like biscuits, jams, etc., which claim to be diabetes friendly or sugar free. And for people with diabetes, they find comfort in consuming that because they assume the label is authentic. Is that the case, or do you think some of these health claims need to be verified as well?
I think all the health claims need to be verified because we don't know which is genuine and which is not. And that is why I think the labeling, Food Labeling Act and the food labeling thing, FSSAI, is now emphasizing on that. And that's a right step forward because we have to see that what is stated in the labels is correct, what the claims are correct. Many of them, they say diabetic friendly, but all that it means that they've not added sugar into it. They'll say no sugar, zero sugar. They don't tell you that it has a lot of fat and trans fats, calories are high, all that they don't tell you. So simply being sugar free doesn't make it very healthy. Second, if they are loaded with some of the sweeteners, even there we have had discussions about the safety of the sweeteners and so on. And there are some people who believe that even these sweeteners can have adverse effects. Although we have seen that in small quantities they don't do any harm. But just being sugar free doesn't make a product very healthy, especially there's a lot of calories, a lot of fat, a lot of saturated fat, trans fats. It can be a very unhealthy product. Just because sugar is taken off, it doesn't mean anything. So these definitely have to be tried and tested. And there are very few genuine diabetes friendly products in the market. And so we need more and more of those.
As a final thought, doctor, because you've been, I think, treating diabetes for what, 30, 40 years now, what would you, for someone listening to you, what are the key messages you would like to leave them with?
So, first of all, I mean, on a more general note, diabetes has a long natural history. And therefore, years before you actually develop the stage of diabetes, you can develop pre-diabetes. You can pick up the condition at the stage of pre-diabetes. at which stage it's very easily reversible. Once you get diabetes, even there are certain categories of people who are obese, short duration diabetes, milder diabetes, where again reversal is possible. If you have crossed that stage and reversal is not possible, then I would say don't worry about it, because it's now very easy to treat and keep the sugars under control. The ABC principle, the HbA1c, which is A, B is blood pressure, C is cholesterol or LDL cholesterol, and D is discipline. So if you just follow the ABCD mantra, then you can get your sugars under good control and keep it under good control. All the other parameters, other comorbidities also under control. People who do that, we find that they have actually a long and healthy life despite diabetes. And very often, some of them do even better than people without diabetes. So there's nothing to worry. Don't worry even if you can't achieve reversal or remission of diabetes. The whole aim is to have a long and healthy life despite diabetes. And the most important for that is to come for a regular diabetes checkup. Because once you see us every 3 months, 4 months, we'll be able to guide you and have course correction. If you think you have no symptoms and you're doing well, you may miss the bus, and then after a year or two, you may find that some damage has set in, which later on we will not be able to correct. So it's very important to have regular follow-up. And if your doctor has told you to take medications, please take them, because again, people are scared about taking medication. Oh, it'll lead to kidney damage, it'll lead to cancer, it'll lead to all that. You don't have to worry about all that. If a good physician will be able to give you the correct dosages of medicines, and these medicines have been proven to be safe. They've been around for 50, 60 years now, and we have not seen any major complications due to them. World Diabetes Day has just crossed. And so on behalf of colleagues and all of us, we'd like to wish you a happy World Diabetes Day. And my vision is that India should become diabetes complications free. It's very difficult to talk about diabetes free India, because diabetes comes even due to aging, family history of diabetes, genetics, so many things. But a complications-free India, without blindness, without amputation, without kidney failure, without heart attacks, without impotency, without any of the complications of diabetes, we should be able to live. And we have shown that 50 years, 60 years survival is not unusual at all. So that is my dream, that we'll have a diabetes complications-free India.
On that heartening note, Doctor, thank you so much for the conversation and insights. So from the BL team and myself, thank you once again.
Thank you, Jyothi, and thank you, Priya.